Peru is a country of over 30 million people, many of whom live in poverty. Around 54% of the population of Peru live under the poverty line of less than $2 per day, and approximately 25% live in extreme poverty of less than $1 per day. Poverty, overcrowding, lack of parental supervision, and a lack of education are important factors that contribute to the high incidence of burns in children. 70% of these children are under 5 years of age. In Peru as a whole, it is estimated that 20,000 children per year suffers burns severe enough to require medical attention. In Lima, 7,000 children per year would benefit from intensive rehabilitation and long-term follow-up care.
Burns are caused mainly in children under 5 years old, and the main cause is boiled water and the different uses in the house. It could be hot pots on the floor, it could be cooking, while cooking, or also during the winter these electrical hot water pots. So there are so many ways that children can get burned in the house. ANICEM is fulfilling a role of the state that is not being taken care of for many years. There is a public health insurance that covers the acute care of burn in children, but after discharge from hospitals, children are left to their own. And basically, parents cannot afford to have rehabilitation. They cannot afford to bring the children to Lima or to bring even to a rehab private clinic.
The scarring from severe burn injuries often creates disfiguration, physical deformity, and functional limitation, requiring specialized rehabilitation and follow-up until the child is fully grown. This is the rehabilitation that ANICEM provides.
ANICEM provides the services of a physician consultant, physical therapy, occupational therapy, psychological assistance, mental health support, and also made pressure garments and splints. And at the moment we take care of more than 1,700 children, and we need a lot of things to do for them, because the treatment takes 1.5 years or almost 2 years sometimes, so it takes a lot of work and a lot of resources to do that.
Canadian Friends of ANICEM Health Development Corporation is a Canadian registered charity, and we've been working for the past 2 years helping the ANICEM clinic in Lima. We are known as CAFA. One of CAFA's programs is transportation, in which we pay for our children who can't otherwise afford it to come to the ANICEM clinic for their rehabilitation. They come from far away and from nearby.
Another CAFA program is the supportive surgery. The public health insurance does not cover very much needed reconstructive surgery for burn survivors, and those that are accepted on a case-by-case basis often have to wait months, even years, for necessary surgery. CAFA provides support for operations in the private sector. Recently, a team of volunteer German doctors collaborated with ANICEM in a 10-day surgery campaign. CAFA enabled the logistics for the ANICEM patients and caregivers by providing the transport, accommodation, medication, and food for more than 18 children.
One of the most exciting programs that we have is our camp program. We have 2 camps a year. 30 to 40 children come to each camp, and they have this unique opportunity to relax and socialize with each other, and it's quite impressive how there's always a few kids who change dramatically over the course of just 3 days.
El campamento que sale a mi hija, pues es para que ella se suelte, porque ella era bien, que te digo, se encerraba y cosas que a veces propios amigos me decían que no quería hablarle y cosas así, y en el campamento pues ella se suelta, ¿no? Yo le llamaba en el celular y me decía, ay mamita, estoy feliz de la vida acá, aquí quiero estar aquí, quiere quedarse, ay. entra a la piscina sin vergüenza, sin miedo y hace las cosas normal.
Fuimos a bañarnos en la piscina, fuimos a juntar leña para hacer así como un morro, quemamos y de ahí nos fuimos allá al segundo piso, fuimos a bailar, el señor nos llevó.
Eso te ayuda a cambiar.
¿Te ayuda a cambiar, te parece?
De lo que estás de mala gana, de lo que no quieres seguir,
Sí.
te hace cambiar.
Another program that CAFA sponsors is capacity building. We pay for staff to take courses to improve their abilities. CAFA also sponsors burn prevention program. We sponsored this brochure this past year, which we passed out to as many people as possible in the community to deal with burn prevention. A more recent program that we sponsored this past year was renovations to the Anichem Clinic. We sort of helped renovate so that the space is more usable, there's more office space, and more room for the therapists.
Carmen recently helped administer a CAFA-sponsored renovation project to improve the first floor of the clinic, including a new office for CAFA staff to more efficiently handle patients, a new office for Anichem staff, and a new waiting area.
CAFA is very important for Anichem because it takes care of some needs of the patients, works in accessibility, and making 2 campaigns in the burn camps during the year. That is very important, especially for adolescents, to develop friendship, to develop social life. And one of the main objectives with common objectives with CAFA is the training of the personnel of Anichem in order to have a very good standards and quality of treatment. That is why CAFA is a key partner in the work of Anichem.
Like all charities, CAFA relies on donations and fundraising events. Costs in Canada are minimal as we rely totally on volunteers. Almost every dollar raised goes directly to the programs in Peru. While we have been successful in building credible programs, our ambitions include adding a staff member that can lead the prevention program and additional expansion of the Anichem Clinic, as well as being able to continue our programs that have already improved the life of many burn survivors.